Video number 7, Unmanaged Stress, What It Can Lead to. We all experience stress to some degree in our daily lives, from work to busy schedules, from important relationships to our goals and dreams. We have competing priorities, and it's a lot to keep on top of. But while a limited amount of stress is normal and even healthy, continuous or severe stress can be very harmful to your physical and mental health. Because all stress isn't the same and different types of stress affect us in ways that are somewhat unique, we are going to uncover how unmanaged stress affects your body. What are the consequences you may have to bear due to unmanaged stress? Let's dive in. Number 1, the effects of unmanaged stress on your body. Central nervous and endocrine systems. Your central nervous system, CNS, is in charge of your fight or flight response. In your brain, the hypothalamus gets the ball rolling, telling your adrenal glands to release the stress hormone adrenaline and cortisol. These hormones rev up your heartbeat and send blood rushing to areas that need it most in an emergency, such as your muscles, heart, and other important organs. When the perceived fear is gone, the hypothalamus should tell all systems to go back to normal. If the CNS fails to return to normal, or if the stressor doesn't go away, the response will continue. Chronic stress is also a factor in behaviors such as overeating or not eating enough, alcohol or drug abuse, and social withdrawal. Respiratory system. Stress and strong emotions can present with respiratory symptoms such as a shortness of breath and rapid breathing as the airways between the nose and the lungs constrict. For people without respiratory disease, this is generally not a problem as the body can manage the additional work to breathe comfortably. But psychological stressors can exacerbate breathing problems for the people with pre-existing respiratory diseases such as asthma and chronic obstructive pulmonary disease, COPD. It includes emphysema and chronic bronchitis. Some studies show that an acute stress, such as the death of a loved one, can actually trigger asthma attacks. In addition, the rapid breathing or hyperventilation caused by stress can bring on a panic attack in someone prone to panic attacks. Working with a psychologist to develop relaxation, breathing, and other cognitive behavioral strategies can help. Cardiovascular. Chronic stress or constant stress experienced over a prolonged period of time can contribute to long-term problems for heart and blood vessels. The consistent and ongoing increase in heart rate and elevated levels of stress hormones and of blood pressure can take a toll on the body. This long-term ongoing stress can increase the risk for hypertension, heart attack, or stroke. Repeated acute stress and persistent chronic stress may also contribute to inflammation in the circulatory system, particularly the coronary arteries, and this is one pathway that is thought to tie stress to heart attack. It also appears that how a person responds to stress can affect cholesterol levels. The risk for heart disease associated with stress appears to differ for women, depending on whether the woman is pre- or postmenopausal. Levels of estrogen in premenopausal women appear to help blood vessels respond better during stress, thereby helping their bodies to better handle stress and protect them against heart disease. Postmenopausal women lose this level of protection due to loss of estrogen, therefore putting them at greater risk for the effects of stress on heart disease. Digestive system. Under stress, your liver produces extra blood sugar, glucose, to give you a boost of energy. If you're under chronic stress, your body may not be able to keep up with this extra glucose surge. Chronic stress may increase your risk of developing type 2 diabetes. The rush of hormones, rapid breathing, and increased heart rate can also upset your digestive system. You're more likely to have heartburn or acid reflux thanks to an increase in stomach acid. Stress doesn't cause ulcers, but it can increase your risk for them and cause existing ulcers to act up. Stress can also affect the way food moves through your body, leading to diarrhea or constipation. You might also experience nausea, vomiting, or stomach aches. Musculoskeletal system. When the body is stressed, muscles tense up. Muscle tension is almost a reflex reaction to stress. the body's way of guarding against injury and pain. With sudden onset stress, the muscles tense up all at once and then release their tension when the stress passes. Chronic stress causes the muscles in the body to be in a more or less constant state of guardedness. When muscles are taut and tense for long periods of time, this may trigger other reactions of the body and even promote stress-related disorders. Often, but not always, there may be an injury that sets off the chronic painful state. What determines whether or not an injured person goes on to suffer from chronic pain is how they respond to the injury. Individuals who are fearful of pain and re-injury and who seek only a physical cause and cure for the injury generally have a worse recovery than individuals who maintain a certain level of moderate, physician-supervised activity. Male reproductive system. Cortisol is important to blood pressure regulation and the normal functioning of several body systems, including cardiovascular, circulatory, and male reproduction. Excess amounts of cortisol can affect the normal biochemical functioning of the male reproductive system. Sexual desire. Chronic stress, ongoing stress over an extended period of time can affect testosterone production, resulting in a decline in sex drive or libido, and can even cause erectile dysfunction or impotence. Reproduction. Chronic stress can also negatively impact sperm production and maturation, causing difficulties in couples who are trying to conceive. Researchers have found that men who experienced 2 or more stressful life events in the past year had a lower percentage of sperm mobility, ability to swim, and a lower percentage of sperm of normal morphology, size, and shape compared with men who did not experience any stressful life events. Disease of the reproductive system. When stress affects the immune system, the body can become vulnerable to infection. In the male anatomy, infection to the testes, prostate gland, and urethra can affect normal male reproductive functioning. Female reproductive system. Menstruation. Stress may affect menstruation among adolescent girls and women in several ways. For example, high levels of stress may be associated with absence or irregular menstrual cycle, more painful periods, and changes in the length of cycles. Sexual desire. Women juggle personal, family, professional, finance, and a broad range of other demands across their lifespan. Stress, distraction, fatigue, etc. may reduce sexual desire, especially when women are simultaneously caring for young children or other ill family members, coping with chronic medical problems, feeling depressed, experiencing relationship difficulties or abuse, etc. Pregnancy. Stress can negatively impact a woman's ability to conceive, the health of her pregnancy, and her postpartum adjustment. Depression is the leading complication of pregnancy and postpartum adjustment. Excess stress increases the likelihood of developing depression and anxiety during this time. Maternal stress can negatively impact fetal and ongoing childhood development and disrupt bonding with the baby in the weeks and months following delivery. Premenstrual syndrome. Stress may make premenstrual syndrome worse or more difficult to cope with, and premenses symptoms may be stressful for many women. The symptoms include cramping, fluid retention, and bloating, negative mood, feeling irritable and blue, and mood swings. Disease of the reproductive system. When stress is high, there is increased chance of exacerbation of symptoms of reproductive disease states, such as herpes simplex virus or polycystic ovary syndrome. The diagnosis and treatment of reproductive cancers can cause significant stress, which warrants additional attention and support. Menopause. As menopause approaches, hormone levels fluctuate rapidly. These changes are associated with anxiety, mood swings, and feeling of distress. Thus, menopause can be a stressor in and of itself. Some physical changes associated with menopause, especially hot flashes, can be difficult to cope with. Furthermore, emotional distress may cause the physical symptoms to be worse. Stress symptoms may be affecting your health, even though you might not realize it. You may think illness is to blame for that nagging headache, your frequent insomnia, or decreased productivity at work, but stress may actually be the culprit. Indeed, stress symptoms may affect your body, your thoughts and feelings, and your behavior. Being able to recognize common stress symptoms can give you a jump on managing them. Stress that's left unmanaged can contribute to many health problems, such as high blood pressure, heart disease, obesity, and diabetes. Thank you for watching. See you in the next video lesson.